Diabetes is a serious chronic health threat.
Diabetes.
Type 2 diabetes.
With diabetes.
Type 1 diabetes.
Diabetes. About diabetes.
Diabetes.
Anything can go wrong.
Pre-diabetes.
Diabetes.
Diabetes.
It's amazing how much everything affects your blood sugar.
My name's Alexis. I'm 34 years old and I have 3 kids. This is our 3rd that we just had. I have a daughter who will be 5 in October, and our son will be 3 next month in May. And then this is Miller, who was born in January. This is the first time I had gestational diabetes out of my 3 pregnancies. The first 2 I did not have it. So yeah, after I took the glucose test, I got a phone call and they sent me to the hospital to meet with the diabetes clinic. They were, at first I was a little bit nervous. There can be stigma around diabetes. There's just not a lot of information. So I was a little bit nervous at first, but after meeting with the diabetes clinic at the hospital, they were really great in giving me a lot of information and providing education. And after that, it was a lot less daunting. The perception that I had before was that it must mean that I was being unhealthy, that I was doing something unsafe or unkind to my body, that I wasn't eating right, that I was doing something wrong. And what I learned was that that wasn't actually the case. A lot of gestational diabetes has to do with hormones. When I was talking to the practitioners, I think they said 1 in 10 women, roughly, develop gestational diabetes, and a lot of times it has to do with your hormones, most of the time. You know, if your family history shows that you're predisposed to diabetes, that probably will play a factor. It wasn't a factor in my case. There's no history of that in my family. But I guess depending on your pregnancy, you know, every pregnancy is different. Our hormones in this one, I guess, were a little bit more out of whack, causing the gestational diabetes.
Gestational diabetes is a type of diabetes that occurs in the 2nd or 3rd trimester of pregnancy. Happens when a woman's body can't produce enough insulin to handle the effects of a growing baby and changing hormone levels. And it occurs in 3 to 20% of women who are pregnant. Although there are some things that can be done to reduce the risk of developing gestational diabetes, such as eating balanced, nutritious meals and keeping active before and during pregnancy, most of the time it's related to placental hormones and therefore not preventable. Changing hormone levels during pregnancy are the biggest contributor, though there are other risks as well, such as being over 35 years of age, having prediabetes, obesity, polycystic ovary syndrome, having a parent or a sibling with type 2 diabetes, and having had gestational diabetes in a previous pregnancy.
It's around 20 weeks, I think, is when you, if you're pregnant, you can go in and you can take there's 2 different glucose tests. One's a short fasting one and the other one's the longer fasting one. With my 2nd pregnancy, I failed a silly term. The shorter test came back inconclusive, so I had to go back for the longer test. The longer test is not very enjoyable. You have to, you fast overnight and then you drink this condensed orange crush soda. It's awful.
There often aren't any obvious symptoms of gestational diabetes. Some women may experience fatigue, increased thirst, frequent urination, though again, it's often not obvious. So in Canada, pregnant women are tested or screened between 24 and 28 weeks. A doctor can give you a requisition to go to the lab. There, they'll give an orange-colored drink that has 50 grams of sugar in it. It's really sweet, and some people like it, some people don't. Have to drink the beverage within 5 minutes, and then stay at the lab for an hour. At the end of that hour, blood will be drawn, and the results will be sent to your doctor. Based on the amount of sugar left in blood at that time, can help diagnose gestational diabetes.
So what is the benefit of testing so much in gestational diabetes? Primarily, it helps to guide treatment decisions and reduce complications in the mother and child. Studies show that reducing your blood sugars helps to reduce the incidence of C-sections, excess maternal weight, and lower the birth weight of babies. Using a CGM has shown even greater benefit. It also helps to reduce the risk of developing ketosis, as ketones are harmful for the fetus. Keeping your blood sugar under control throughout pregnancy also helps to reduce the risk of developing diabetes later in life.
When you find out you have gestational diabetes, I went in to meet with the dietitians and the nutritionist, and then they follow up with you. First, I tracked my sugars 4 times a day. So as soon as I woke up in the morning, an hour after breakfast, an hour after lunch, and an hour after dinner. So I tracked that for 2 weeks, and then I met with the dietitians again, and they review all of your numbers, and then they will either make recommendations on if you need to change your diet or make edits. Or one of the things that I didn't know was they encourage you to have a snack late at night to help you manage your sugars with your hormones overnight, which is not, we never snack late at night. So it was a funny thing for me to get used to. And then after that first initial appointment, they do a bunch of education, and then you meet with them weekly or bi-weekly, depending on your numbers. And so you continue to track your numbers, and they just continue to monitor.
It can be beneficial for everybody, but particularly those that have gestational diabetes. A dietitian can provide evidence-based information to help you feel more confident and less stressed when it comes to gestational diabetes management. They can provide information on topics such as glycemic index, carbohydrate counting if that's needed, how to balance meals with carbohydrate, protein, and fat, how to time meals throughout the day, so how often to eat, and what to do when eating away from home.
I didn't realize that, again, we eat fairly healthy. We don't eat a lot of processed foods in our house. And I didn't know much about the glycemic index, and I didn't realize how much of the foods that we eat are on the good end of the glycemic index. So that was kind of educational when I met with them. And the dietitian started going through the different, the good foods to eat on the glycemic index. And I was like, oh, well, we eat that. Oh, we eat that. So it was educational because I hadn't really thought about any of those things before. And I was like, oh, we actually do a pretty good job of eating good quality food that helps me manage the diabetes. So that was really interesting.
In terms of treatment, so nutrition, lifestyle interventions, and medication are the cornerstones of treatment for gestational diabetes. After diagnoses, people are usually referred to a diabetes clinic or a registered dietitian. A registered dietitian can help you understand nutrition requirements during pregnancy, as well as considerations for blood sugar control. They can also teach about physical activity that benefits blood sugars, when to move your body, and for how long. That being said, despite people's best efforts, sometimes pregnancy hormones prevail over nutrition and lifestyle interventions. When that happens, medication may be required, and people's doctors would guide them through that process. Nonetheless, learning about nutrition and lifestyle interventions can still be really helpful and used in conjunction with medication.
When I went to go and see the dietitians, they gave me the blood testing kit, and they gave me one round of spare needles and testing strips, but I think they said I could go to the pharmacy afterwards, but I was unaware if I could just pick them, if it was an over-the-counter product or if I needed a prescription for it, or how that worked. So that was a bit of an educational piece, but I just popped in and was able to ask it at the local pharmacy. And you guys were really great in helping. It was a prescription. We have benefits, so it was, if not entirely covered, mostly covered. But that was a bit of a learning curve.
So you can use a glucose meter to monitor blood sugars with gestational diabetes. I think a pharmacist and a physician or a diabetes team would probably guide how often that needs to be done.
Injecting insulin, that is, I thought that was going to be really scary, but it was surprisingly not. First you have to take your blood. So there's the little needle prick in your finger, which you get used to really quickly because you have to do it 4 times a day. And actually injecting insulin is less painful than pricking your finger every day. The needle is so fine, and it's such a slick system. It's, I was worried about it. I thought I'd have to get my husband to do it, but it was no big deal. You do it in the fatty parts of your tummy. They say you can do it in your thigh or in your arm as well. I guess some people are uncomfortable with the idea of a needle being that close to their stomach and their baby, but the needle's quite short and it does not go anywhere close to your baby. At first it was a little bit daunting, but once you get used to it, you don't even feel the needle go in. It's pretty straightforward. As I got further along in my pregnancy, even though I managed my insulin or my numbers overnight with insulin, I guess it's quite common that your blood sugar level will continue to creep up. I think it's to 38 or 36 weeks. And so even though I was managing it with insulin, I had to increase the amount of insulin I used kind of every week or so just to kind of keep up with it, but it never really got unmanageable that way. I did have extra ultrasounds starting at 30 weeks. I think it was every 2 weeks, and I believe they were monitoring the baby for the size. So their head size, and what I was told was their head size, their femur length, and I think their torso or their stomach width. And I had asked about, like, I was like, at what stage is there an issue? And what they said was, as long as they're all, you know, if they're all in the 90th percentile, that's fine. Or if they're all in the 60th percentile, that's fine. But what they don't want to see is a stomach that's way bigger than everything else. And so that's what they were monitoring for. So I did have several extra ultrasounds starting at 30 weeks to monitor that. Ultrasounds give you a rough weight. They can give you kind of a rough weight, but I think they can be plus or minus a pound off. They're not the most accurate, but I think usually your healthcare team will err on the side of caution and assume the kid is larger than the opposite, because more complications happen when they're larger. So they thought he would be well over 8 pounds, if not closer to 9. And he was actually my smallest child at 7'14". So even though I had gestational diabetes, he actually came out quite, not small, but smaller than my other two where I didn't have gestational diabetes.
It's related to mom having more blood sugar. Babies subsequently have more insulin in their bodies to accommodate with that blood sugar. That can lead them to grow bigger, and then that's what also causes the hypoglycemia afterwards. If they have more insulin while they're in mom's belly and receiving that sugar, after birth they no longer have access to that blood sugar supply, and so their blood sugar can fall lower.
Throughout pregnancy, the amount of insulin-resisting hormones produced by the placenta continues to increase. This leads to intensifying insulin therapy or adding other medications. And that's why it's important that we check our blood sugars so that we can keep our therapies on track. Once a baby's born, medications and therapies can go back down to pre-pregnancy levels. And except for type 1 diabetes, we want to stop the insulin on the day of delivery to prevent hypoglycemia in the infant.
I'm no medical expert when it comes to these things, but that's what the midwives had said, that because I was able to manage it and keep my blood sugar levels within the range, that's why he was, you know, a good healthy size and not exceptionally large. When you have gestational diabetes, they usually want you to deliver your baby before you hit 40 weeks, which means that if I had hit the week before 39, or that week of 39 weeks, they'll start to induce you if you're not going into labor, because they don't want the baby to go past the full 40 weeks, which meant that Miller was delivered at 38 and 3, I think. So he was delivered before, but I was doing lots of things to try and induce labor and get it going because I didn't want to be induced. That is one of the, I would say, the risks with gestational diabetes.
There are complications of gestational diabetes if it's left untreated, and these can be discussed with your doctor. It includes things such as high blood pressure or baby growing quite large, which can lead to difficulties during delivery or an increased risk of needing a cesarean section. As well as for mom, it increases the risk that gestational diabetes will occur in future pregnancies, or that they'll develop type 2 diabetes later on as well. For baby, same as mom, difficulties during delivery can be a factor, and then they may also be hypoglycemic after birth.
Because of the risk of a larger baby, which is one of the risks with gestational diabetes, my midwifery care continued, but they also refer you to an OBGYN just to review the risks, and in case you do need somebody additional help in delivery, that you've already consulted with an OBGYN and that you're familiar with them, they know your situation, So at 36 weeks, I went in and I met with a local OBGYN here in town.
There is an increased risk of developing recurrent gestational diabetes or type 2 diabetes later on. So continuing to have regular follow-up with your doctor so that screening and testing can be completed is really important. Also, continuing to follow up with a registered dietitian can be helpful because they can provide lifestyle strategies for reducing the risk of recurrent gestational diabetes or type 2 diabetes. They can also help with things after delivery like infant feeding and provide practical tips to ensure caregivers are meeting their nutrient needs as they navigate this new phase of life.
They have said that there is a chance, I think you just will get tested every several years, or I'm sure there's signs that you can look for in your body. There is a low chance. I think if you're unable to manage it during pregnancy, that increases your risk later on. I was able to manage it quite well. So who knows what the future will bring, but that is a risk. Yeah, we'll see what happens with that one.
A really good prognosis, it can be well managed throughout pregnancy. And then typically after pregnancy, the woman no longer has diabetes after that point. So there is increased risk of developing recurrent gestational diabetes or type 2 diabetes later in life, but typically after pregnancy, it resolves. For people who already have diabetes, they can also go on to have healthy pregnancies. It's really important to continue with usual treatment, to have really close follow-up with your healthcare providers to ensure both mom and baby are safe and healthy throughout pregnancy, but they can go on to have healthy pregnancies as well.
Mothers with gestational diabetes are encouraged to breastfeed for at least 4 months after giving birth to reduce the risk of developing diabetes in herself and her child. It also helps to reduce the risk of developing hypoglycemia and childhood obesity, as well as other health concerns. After giving birth, it's a good idea to check after 6 weeks to 6 months to ensure that maternal blood sugars have gone back to normal, and also a good idea to check every 3 years, or if you're planning another pregnancy.
I think education is a big piece. Lean into your team. You have your midwife. You should get a referral to an OBGYN. You have the dietitian and the nurses. Actually, one of the first things I did is I've got a group of a few mums. A group of a few mums, and we all chat together, ask questions about different things. The first thing I did was say, hey, has anybody had gestational diabetes before, so that I could ask them questions, and one of the mums had. So I was able to ask her a couple questions. Lean into your team, lean into your village, lean into whoever it is that you know, and ask them questions, because the more you know, the better you can manage whatever you have going on.
I think it can be incredibly helpful to develop a community. If you have gestational diabetes, being able to talk to other people who are going through similar things and sharing information and experiences can be really helpful to make people feel like they're not alone, because they're really not. It's a high percentage of pregnant women who develop gestational diabetes, and I think being able to come together to discuss and share can be really helpful.
I have a group of moms that we're really good friends. Our husbands all work together. So we have our own little Facebook group. I'm also part of some larger groups on Facebook for moms. There's Mamas for Mamas, which helps with, whether you need formula or diapers or whatever you need. It helps with that, but it's also just a good resource. And if you have to ask, if you're, embarrassed, you can always ask anonymously, but you can always ask with your name. And I find more often than not, people are willing to share. If someone asks, I'm always willing to share and give some information about my experience. And so, sometimes if you don't necessarily feel comfortable with your healthcare providers or the resources that you have through the hospital, then you can always reach out to other mums and see, because more often than not, people are more than willing to share their experience. Use the resources that you have. The information that I was able to get from the dietitians and the nutritionists at the diabetes clinic, they were really helpful. If you're with a midwife, oh, bless you. If you're with a midwife, they're also extremely helpful and knowledgeable. While they might not have specific gestational diabetes information, they also have resources that they can refer you to. I always say that knowledge is power, so the more information you have, the less scary it is. It can be kind of, I wouldn't say it was scary, but it was daunting and overwhelming at first. I was like, oh Lord, not another thing. But as I learned about it, it actually was quite straightforward to manage. And there were a lot of resources if I needed anything. So I would say lean into the resources and the people you have. And if you can take a couple minutes out of your day to do a little bit of research and to learn a little bit, it usually is not as scary once you have a little bit of knowledge in your back pocket.
You can still have a very healthy pregnancy even with gestational diabetes. It may involve more appointments and follow-up with either a diabetes clinic and their team there or a registered dietitian, but it can still look like a healthy, comfortable pregnancy.
I ended up with gestational diabetes, and at first I was concerned with the stigma and just my lack of knowledge around the whole thing, but reaching out to some close friends and then also the healthcare professionals that were provided, I was able to learn a lot and manage it myself with little to no complications during my pregnancy and delivery. If you end up with gestational diabetes, reach out to your network, to your friends, to your colleagues, to anyone that's willing to kind of help you out. It's not as difficult once you do some research and learn about it. It's not as daunting or as overwhelming as it might seem at first.
Thank you for watching our episode on gestational diabetes. Don't miss our series finale, where we talk with Derek about how he uses diabetes as motivation to lead a healthier lifestyle and make the most out of life.